Good morning again, everyone. I am Dana Patricia S. Son, and I'll be enumerating and discussing briefly the different problems associated with changes in voiding. First is frequency. Frequency refers to the number of times or how often a person voids. This can be caused by an overactive bladder, and the bladder might contract when it doesn't need to. Second is urgency. Urgency is the sudden urge to void due to involuntary contractions of the bladder muscle. This is one of the hallmark symptoms of urinary tract infection or UTI and can be related to other conditions. Third is dysuria. Dysuria is used to describe painful or difficult urination, which often signifies an infection of the lower urinary tract. The discomfort is usually described by the patient as burning, stinging, or itching. Next is hesitancy. Hesitancy is when you have delay or difficulty in starting to void. Fifth is incontinence. Incontinence is the involuntary loss of urine. It can be divided into stress, such as leaking with coughing, straining, laughing, or activity. Urge, loss of urine preceded by sense or urgency to urinate, or mixed stress, or urge incontinence based on symptoms and pathogenesis. Sixth is nocturia. Nocturia refers to the excessive urination at night. This means that most people wake up once during the night to urinate. This condition becomes more common as people age and occurs in both men and women, sometimes for different reasons. Seventh is enuresis. Enuresis is the medical term for involuntary voiding during sleep, or, in other words, wetting. Other words for this problem includes incontinence, voiding problems, or urinary accidents. Eighth is polyuria. Polyuria is a condition where the body urinates more than usual and passes excessive or abnormally large amounts of urine each time you urinate. It is defined as the frequent passage of large volumes of urine, more than 3 liters a day, compared to the normal daily urine output in adults of about 1 to 2 liters. Next is oliguria. Oliguria is considered to be a urinary output of less than 400 to 500 milliliters per day. This can be caused by dehydration, burns and other serious injuries, or obstruction. Next is anuria. Anuria is a non-passage of urine. In practice, it is defined as passage of less than 50 to 100 milliliters of urine in a day. Next is hematuria. Hematuria is the presence of blood in a person's urine. The two types of hematuria are gross and microscopic. Gross hematuria is when a person can see the blood in his or her urine, while microscopic hematuria is when a person cannot see the blood in his or her urine, yet it is seen under a microscope. This condition is often a sign of kidney disease. And lastly, we have proteinuria. Proteinuria is a condition where there is an abnormal amount of protein in the urine of a person. This condition is often a sign of kidney disease.
Good day, everyone. My name is Rovan John Anthony Tikala, reporting CLO8 and CLO9. CLO8 common diseases that occur due to poor perineal hygiene. First, urinary tract infection or UTI is a clinical condition that may involve the urethra and the bladder, lower urinary tract, and the ureters, renal pelvis, caesis, and renal parenchyma, upper urinary tract. Causes of UTI may include pregnancy, condition that blocks the urinary tract such as kidney stone, condition that make it difficult to fully empty the bladder, such as enlarged prostate gland in men, and constipation for children, urinary catheters, and having a weakened immune system, for example, having a type 2 diabetes or chemotherapy. Symptoms of UTI includes burning or pain with urination, dysuria, irritation of the bladder, cystitis characterized by urgency, frequency, incontinence, suprapubic tenderness, foul smelly cloudy urine. Next disease is the pyelonephritis. It is an inflammation of the kidney due to bacterial inflammation. Upper urinary tract or kidney infection tends to present with fever and may lead to renal scarring, hypertension, and renal disease. Also, it is a type of urinary tract infection that generally begin in your urethra or bladder and travel to one or both of your kidneys according by Mayo 2019. The infection usually starts in the lower urinary tract as a urinary tract infection or UTI. Bacteria enters the body through the urethra and begins to multiply and spread up to the bladder. From there, the bacteria travel through the ureters to the kidney. Causes of pyelonephritis is bacteria. Example Escherichia coli and any serious infection in the bloodstream. Symptoms usually appears within 2 days of infection. Common symptoms include a fever greater than 102 Fahrenheit or 38.9 Celsius, pain in the abdomen, back, side, or groin, painful or burning urination, cloudy urine, pus or blood in the urine, urgent or frequent urination, fishy, smelly urine. Other symptoms can include shaking or chills, nausea, vomiting, general aching or ill feeling, fatigue, moist skin, mental confusion. Next disease is the glomerulonephritis. Glomerulonephritis is an inflammation of the glomeruli of the kidney. May occur as a separate but usually occur in children as an immune complex disease after infection with nephrogenic streptococci where complement a cascade of protein activated by antigen antibody reaction, plugs or obstructs glomeruli. There are two types of glomerulonephritis, acute glomerulonephritis and chronic glomerulonephritis. Cause of acute glomerulonephritis. The acute disease may be caused by infections such as strep throat. It may also be caused by other illnesses including lupus, good posture syndrome, Rager disease, polyarthritis nodosa. Early diagnosis and prompt treatment are important to prevent kidney failure. Causes of chronic glomerulonephritis. Sometimes the disease runs into the family. This kind of often shows up in young men who may also have hearing loss, vision loss. Some forms are caused by changing or changes in the immune system. Early signs and symptoms of chronic form may include blood or protein in the urine, hematuria, proteinuria, high blood pressure, swelling of your ankles or face, edema, frequent nighttime or urination, very bubbly or foamy urine. CLO number 9. The different guidelines in perineal flushing, serving bedpans, and urinals. Guidelines in perineal care. Prepare all materials ahead of time. Observe microbiology principles with medical hand washing and use of gloves. Put in place materials enriched in case needed. Example is waste receptacle and cotton balls. Inform patient of procedure before performing and during. Expose only what is needed. To ensure privacy, soap or wipe in a downward zigzag motion from the top to the back of the perineum. Use one cotton per stroke when soaping. Assist in changing patient underwear if needed. Do aftercare accordingly to replenish materials for next use. Guidelines of serving bedpans and urinals. Prepare all needed materials ahead of time. Ensure privacy for client. Observe microbiology principle. Create an environment with comfortable interaction between nurse and client. Ask client's permission before performing the procedure. Ensure the knowledge of the client before acting on an action. When using metal bedpans, use warm running water to make the patient comfortable. Lower head of the bed, side railing, and bed height and preference of nurse comfort. Have assistant to roll the patient if he is immobile. Put down covers only as far as needed when serving or removing the bedpan. Offer washcloth to the patient to wipe hands or genitalia. Empty the bedpan approximately into a patient's toilet. Urinals. This is the guidelines of urinals. Prepare all materials ahead of time. Observe microbiology principle. Instruct client on proper way to utilize urinals. Inspect placement of urinals to avoid spillage. Give patients privacy and time to void. Note any difficulty of pain within voiding. Thank you. That's all.
Good day, I'm Miss Macias and I will be discussing CLO number 10. Enumerate nursing responsibilities before, during, and after perineal flushing, serving bedpans and urinals. So in serving bedpan, before, first do medical hand washing. Second, obtain necessary supplies and proceed to the patient's room. 3. Respect patient's privacy. 4. Leave clean washcloths, towel, and basin with warm water at the bedside for use during bedpan removal. 5. If bedpan is metal, place it under warm, running water for a few seconds. This is to make the bedpan room temperature. Then dry it, making sure bedpan is not too hot. 6. Raise the side rail on the opposite side from where you're working. 7. Raise the bed to a comfortable height. Lower head of the bed flat. 8. Prepare the patient by folding down the covers to a point that will allow for placement of the bedpan. And then 9. Don clean gloves. So during serving bedpan, for the patient able to move or turn independently on bed. A. Ask the patient to lift her hips. The patient may need to raise her knees to a flexed position, place her feet flat on the bed and push up. Assist patient to raise her hips by sliding a hand under her back. Then, place the bedpan under the patient's buttocks so that the wide, rounded end is toward the back. Do not push the pan under the patient's buttocks to prevent injury. When using a fracture pen, place the wide rounded end toward the front. For the patient who is unable to move or turn independently, A. Ask for help from another healthcare worker if the patient's condition warrants. B. Assist the patient to side-lying position. Use a turn sheet if necessary. C. Place the bedpan against the patient's buttocks so that the wide rounded end is toward the head. When using a fracture pan, place the wide rounded end towards the feet. D. Holding the bedpan in place, slowly roll the patient's back and onto the bedpan. So after serving the bedpan, replace the covers. Raise the head of the bed to a position of comfort for the patient. Place a rolled towel, blanket, or a small pillow under the sacrum for comfort. Place the call light and toilet tissue within the patient's reach. Make certain that the bed is back at its lowest position and the upper side rail is raised. So in removing bedpan, before, wet the washcloths with warm water and place them near the working area. Then second is do perineal flushing. Then during removing bedpan, if the patient is immobile, lower the head of the patient's bed. Pull down the covers only as far as needed to remove the bedpan. 4. Offer the patient toilet paper. Then ask the patient to raise her hips, stabilize and remove the bedpan. If the patient is unable to raise her hip, stabilize the bedpan and assist her to the side lining position. 6 is cleanse the buttocks with a warm, wet washcloth or wash patient's hands. Dry with a towel. Then replace covers and position the patient for comfort. Offer the patient the second washcloth moistened with warm water to cleanse her hands. 8. Empty the bedpan into the patient's toilet. Measure the output, then clean the bedpan. Next is remove soiled gloves and do medical hand washing. Then document amount of urine voided, bowel movement, and note presence of unusual characteristics of either urine or stool. If the patient is immobile, lower the head of the patient's bed. Pull down the covers only as far as needed to remove the bedpan. So 13. Offer the patient toilet paper. Ask the patient to raise her hips. Stabilize and remove the bedpan. If the patient is unable to raise her hip, stabilize the bedpan and assist her to a side-lying position. Then cleanse the buttocks with a warm, wet washcloth or wash patient's hands. Dry with a towel. After removing bedpan, offer the patient toilet paper. Ask the patient to raise her hips. Stabilize and remove the bedpan. If the patient is unable to raise her hip, stabilize the bedpan and assist her to the side-lying position. Then replace the covers and position the patient for comfort. Offer the patient the second washcloth moistened with warm water to cleanse her hands. If the patient is immobile, lower the head of the patient's bed. Pull down the covers only as far as needed to remove the bedpan. Empty the bedpan into the patient's toilet. Measure the output, then clean the bedpan. Remove soiled gloves and do medical hand washing. Document amount of urine voided, bowel movement, and note presence of unusual characteristics of either urine or stool. In serving urinal for male. Before, do medical hand washing. Then, don gloves. During, if patient is able, offer urinal. If patient is unable, assist patient. Slip rim of urinal under the gland's penis to keep it in place. Then, inspect placement of urinal to avoid spillage. Give patient enough time for voiding. Ask patient to call you when through. After, remove and cover urinal immediately. Wash patient's hands or use wet washcloth and dry. Have articles cleaned and ready for next use. Then remove gloves and do medical hand washing. Record observations of difficulty in voiding, complaints of pain or discomfort, and abnormal characteristics of urine. Then note if bedridden male patients want to defecate, follow procedure for serving bedpan. In perineal flushing for females. Before, read patient's chart. Explain procedure to the patient. Perform medical hand washing, then bring materials to bedside. Provide screen. Lock the door if permissible once in the patient's room to provide privacy for the patient. Then 5. Replace top sheet with bath blanket by fan folding the top sheet to the foot part of the bed. Then, don gloves. Place bedpan's flat surface under the patient's buttocks, holding the side of the bedpan while serving. Arrange bath blanket into a triangular drape over patient with upper angle pointing forward patient's head and the opposite in between patient's legs. Position the patient. Use the two lateral angles of the bath blanket to cover each thigh. So place waste receptacles near the bedpan. During, inform patient when you are about to pour water over the vulva. Pour over mons pubis, moving down to the vulva and perineum. Then, using the pickup forceps, pick one soapy cotton ball and receive it with the dressing forceps. Soap area starting from the mons pubis, going down in a zigzag motion, not reaching the urinary meatus. Discard the cotton ball. 12. Follow steps number 10. Use a pickup forceps, and then pick one soapy cotton ball and receive it with the dressing forceps. Then, soap the vulva starting from the clitoris down to the fold of the labia minora in a descending manner. Start on the side that is farthest to you. Discard the cotton ball. Then, pick up another soapy cotton and soap the side near you. Discard the cotton ball. Then, pick up another cotton ball, soap labia majora in the same manner as to the labia minora. Then pick up another cotton ball, soap the center part of the vulva from the clitoris going down to the anal area. Discard the cotton ball. Then pick up another cotton ball, soap sides of the thighs starting from the inguinal area in a zigzag motion. Use cotton ball for each part starting on the side farthest to you, then to the nearest you. Then repeat soaping as needed. Rinse area with lukewarm water. Repeat as necessary to remove soap. Use dressing forceps with cotton balls while rinsing and separate the folds. Dry area using the dry cotton balls in the same manner as soaping, paying attention in between the folds. Then remove bedpan and place it under the bed. Turn patient to the side. Wipe and dry buttocks and anal region with tissue paper. After perineal flushing for females, reposition patient on her back and replace with bath blanket with top sheet. Make patient comfortable. 23. Assist in changing underwear if necessary. Then throw waste receptacle in trash bin. Empty bedpan in toilet bowl. Clean and place on rack to dry and clean the room. Then do aftercare, replenish materials for next use. Then do documentation. So perineal flushing for males. So in before, follow steps 1 to 8 in perineal flushing for female, which was read patient's chart, explain procedure to the patient, perform medical hand washing, bring materials to the bedside, provide privacy for the patient, replace the top sheet with bath blanket, don gloves, arrange the bath blanket into a triangular drape over the patient, then place waste receptacles near the bedpan. So during perineal flushing for males, inform patient when you're about to pour water over the genital. Pour over mons pubis and penis down to the perineum. Then, using the picking forceps, pick one soapy cotton ball and receive it with a dressing forceps. Soap area starting from the mons pubis going down in a zigzag motion until the base of the penile shaft. Discard cotton ball. Using another soapy cotton, soap urinary mucus down to the glans penis in a circular motion. Discard the cotton ball. Then, soap the penile shaft from top to bottom using one soapy cotton ball for each stroke. Soap entire penile shaft. 7. Soap scrotal area following the contour of each rugae using one soapy cotton ball for each stroke. In cleansing the anal region, start from the middle of the scrotal area going down to the anus. Discard the cotton ball. Soap sides of the thigh in the same manner as in the female. Serve urinal if patient desires to void in the middle of the procedure. And 10. Repeat soaping as needed. So after perineal flushing for males, follow steps 18 to 27 in perineal flushing for female, which was rinse the area with lukewarm water and repeat as necessary in order to remove the soap. Then dry area using dry cotton balls in the same manner as soaping. Remove bedpan and place it under the bed. Turn the patient to the side. Wipe and dry buttocks and anal region with tissue paper. Reposition patient on her or his back and replace with bath blanket with top sheet. Make the patient feel comfortable. Assist in changing underwear if necessary. Throw waste receptacle in the trash bin. Empty bedpan and toilet bowl. Clean and place on rack to dry and clean the room. Do aftercare and then do documentation. So that's all there is to note in CLO number 10, enumeration of nursing responsibilities before, during, and after perineal flushing, serving bedpans and urinals. The next CLO will be discussed by the next group member.
Good morning once again. So I'll be reporting for CLO number 12, which is the documentation of client responses and outcomes before, during, and after serving bedpans and urinals. So first, you document or record the following in the bedpans. 1. The amount of urine voided. 2. The bowel movement of the patient. And 3. The presence of unusual characteristics of either urine or stool. In the urinals, first, you observe of difficulties in voiding. Second, complaints of pain or discomfort. And third, the abnormal characteristics of urine.